Perfect. Well, first off, thanks for everybody for hopping on. My name is Matt Skarzinski. I help coordinate this webinar series. Today we have the pleasure of hearing from Dr. Elahi, who is a movement disorder specialist and neurologist, and also a clinical neurophysiologist at Loyola Medical Center in Maywood, Illinois. He'll be discussing Parkinson's, essential tremor, and then a therapy option called DBS, or deep brain stimulation, for both of those disease states. So I'll let him introduce himself more, but if you have any questions, please feel free to put them in the chat box, and then we're going to have a Q&A section at the end of this presentation. So if you have questions right now, feel free to put them in there. Or if you have a question and you want to save it for later, feel free to type it in later, but we'll get to all those at the end. So without further ado, Dr. Elahi, I'll let you take it away.
Thank you, Matt, for the kind introduction. I'm Dr. Elahi, and I'm director of the movement disorder program at Loyola. And I've been in the field of movement disorders and neuromodulation for quite a long time. Did some research on it back in when I was doing my PhD and later on in my career. We're trying to build a program here at Loyola, and this is part of those effort to help kind of educate people about movement disorders in general, and also trying to address some of the questions that the patient had and things that they didn't know about Parkinson disease or other therapies that exist. And hopefully this is going to be useful for everybody. The presentation is relatively short, and feel free to put your questions in the chat box, and we will try to get to those questions, as many questions as we can. As a matter of fact, just to a disclaimer here that this is not going to substitute your doctors, and this is just for information purposes. We're briefly going to talk about Parkinson's disease in general. During the talk, we're going to also briefly touch on essential tremor as well, because they share some of the features, but the talk is heavily, focused mostly on the Parkinson's disease itself. We're going to talk a little bit Parkinson's disease, and then we'll jump into the treatment, advanced treatments for Parkinson's disease. Initially, the name comes from Dr. Parkinson, which about a century ago, more than a century ago, described the Parkinson's disease. At that time, they used to call it shaking palsy, but later on, in honor of Dr. Parkinson, got his name on the disease. It's a frequent disorder, second most common disorder we see in neurodegenerative field after the Alzheimer's disease, and almost 1 out of 10 people after age of 50 can have the diagnosis of Parkinson or Parkinsonism. It is caused by deficiency of a substance in the brain called dopamine, and it's still the mainstay of treatment for most patients are levodopa treatment, which is replacement of the dopamine in the brain, which improves most of the Parkinson's symptoms. Diagnosis is still a clinical diagnosis. We know that it's because of the reduction in dopamine. Sometimes we do scans or other tests to support the diagnosis, the clinical diagnosis of Parkinson's disease. And some of you guys may be familiar with the DAT scan or dopamine transporter scan. You see the pictures of it on your screen on the right. And the right picture shows an abnormal scan. We see the dopamine reduction. The yellow-orange part of the brain shows a smaller size, and that usually indicates a reduction in brain production of dopamine, which you can see that in Parkinson's disease, but you can also see it in other conditions. So it's not 100% a diagnostic feature, and it still will rely heavily on the presentation and clinical features to give people the diagnosis. A lot of work is still going on for us to understand what caused this disease. And what we know so far is Parkinson's disease often is a combination of genetic factors and an environmental injury. And usually when these two things happen and a certain predisposing gene are available and people exposed to something environmental, it creates this cascade of abnormal protein production, which eventually causes neuronal cell demise, dopamine deficiency, and later on Parkinson's disease. So people go through these stages, not necessarily will show the symptoms of Parkinson's disease initially. We call this a stage premotor phase. So people don't have signs and symptoms of Parkinson's disease, but the brain already have the disease. Some factors have been shown to protect the brain on those stages, like exercising, sometimes caffeine has been shown to delay some of these motor symptoms for some time. And eventually people get to the motor phase and they get the clinical diagnosis of Parkinson's disease. But takeaway message from this is that in majority of the cases, we call them idiopathic or sporadic Parkinson's disease. It's likely a combination of environmental factors and genes that will cause the disease. In younger people, sometimes we can find a gene that is responsible for this or certain variants of the Parkinson's disease, but in majority of the cases fall under the category of the sporadic or idiopathic Parkinson's. Now, we have to diagnose somebody with Parkinson's disease, you need to have certain cardinal features or main features of Parkinson's. And those features are tremor or shaking. Most of the time we see the shaking when people are resting their hand on their lap and they're looking down and they start seeing the hands start to shake. A lot of time that's the initial manifestation. Initially, it can be one-sided and then later on both sides or stay on one side. The second feature is a stiffness. We also call it rigidity. Third feature is a slowing of the movement. That is probably the most important feature to help us diagnose the disease, and that's the slowing of the movement. Overall, things will get slow. People will start having a slower handwriting, maybe a smaller handwriting. They can walk slower. They can shuffle their gait. They can have difficulty swinging their arms. Masked faces, like their facial expression, get a little bit less pronounced, and those are all manifestations of the slowing of the movements. And those are what we call motor manifestation of the disease. But this is not just motor symptoms. By the time people get the diagnosis of Parkinson's disease, more than 90% of the dopamine-producing cells already are dead in their brain. And just these motor manifestations is the tip of the iceberg. There's a lots of these other symptoms that are consequence of the Parkinson's disease or from the Parkinson's disease that we often ask very frequently about them in the clinic, but they might not be very obvious to most people. And that could be a loss of different symptoms from anxiety, memory issues, difficulty with the sleep, fatigue, lack of sense of the smell, vivid dreams that you often can see, muscle spasms, and many, many others that can be attributed to Parkinson's. Some of these symptoms can even be present many years before anybody get the diagnosis of Parkinson's. So it's very important to know them, very important to manage them. Nowadays, we have been able to kind of optimize the treatment for Parkinson's disease very well. So we can do certain things about these symptoms. It's very important to talk to your doctors about them. As I said, I'm going to briefly touch on essential tremor, which doesn't have any of those features of the Parkinson that we talked about, but they do share the symptoms of the tremor, which is slightly different than the tremor that you see in Parkinson's disease and often can be misdiagnosed. Sometimes there's an overlap between the Parkinson's disease and essential tremor that can get confusing at sometimes. And it's also important to people who have Parkinson's disease or have essential tremor, or people who sometimes have them both, to also discuss it with their doctors because certainly they are treated very differently. Here, I'm going to show you two videos of people with significant tremor On this picture, you see a person with a resting tremor, as you can see often in Parkinson disease. And here on the left is a person with essential tremor, also very severe tremor, difficulty writing with significant amount of tremor, as you can see that on this video. Very disabling, obviously, for many patients. Very difficult to manage with medication sometimes. We have medication, but sometimes medication is not enough when people have this much of a significant tremor, as you can see it here. Now, moving forward, there are more advanced treatment for Parkinson's disease exist that includes deep brain stimulation, gel form infusion through the stomach, cell therapies, and others. If you are interested in knowing about those advanced therapies, please continue to see the next video in this channel. Hope the information provided to you in this video has been useful and can help you make treatment decisions and speak with your healthcare providers with more understanding of the process. Thanks for watching these. We'll see you next.